Hello, Kowai Post viewers. We have with us today Dr. Anand Khakhar, Senior Transplant Surgeon, and Dr. B.C. Roy, awardee, talking about the transplant scenario in our country. Doctor, as far as transplants are concerned, is there a major demand-supply gap?
Oh, huge.
Okay.
The number of transplants that are needed in the country every year is about 50,000 liver. When you talk about liver transplants, when you talk to kidney transplants, the number goes to at least twice of that. And even the number of heart and lung transplants go to more than at least 10,000 a year.
Okay.
And what's more is that every year about 50,000 patients get added on to the liver transplant waiting lists. In comparison to this, the total number of liver transplantations done in our country do not exceed 1,500 to 2,000. So against a demand of about 50,000, all you are able to provide is less than 2,000. So what are we looking at? 50,000 to 2,000. So it's about more than 90% gap in it.
Right. So is that because of the availability of, or rather the non-availability of organs?
It's a combination of both. Now, if you talk about cadaveric organs, out of this 2,000, not even 200 are cadaverics. And the rest of the organs are from living donors, from friends and family members. So, in spite of that, the gap is more than 90%. So, if you're going to talk about merely cadaveric donors, then the gap is like 95+%.
Okay. So, doctor, as far as heart transplant is concerned, tell us about it and, as compared to the West, how slow or how backward are we?
So, heart transplantation, as in all other solid organ transplantations, we are technologically not far behind. The technology as well as the techniques are adequately available in our hospitals, infrastructure, as well as in our technically trained manpower teams. So I don't think we perform anything inferior to anybody else in the world. Our outcomes are therefore very comparable to some of the best centers in the world, including the best centers in the West. Where we lack is in the awareness of organ donation, not just into the public at large, but in the system, including the healthcare system. The processes related to organ donation, right from the identification of donor all the way to getting the donor on the operation table, are all flawed and therefore slow, and therefore they yield a much lower number as compared to what we should get. Yes.
Okay. So, do you think the government is doing enough as far as creating awareness is concerned?
We as Indians are used to blaming it on the government. You blame it on the weather, you blame it on the government. It's the same thing. How about us? We have the ability to do it. All those involved in healthcare, every hospital that runs an ICU or neurology, neurosurgery setup has the capacity to develop a small cadaveric program within the setup. So one need not wait for the government to do everything. The government should take care of malaria.
So are you saying that the hospitals are not doing enough?
They are not doing enough, yes. The answer is very clearly, unequivocally, yes.
Okay. And, you have a lot of skin grafting, as it is called. So how is that as compared to the other organs?
So skin is a tissue. When you say organs, they are like solid viscera, which have an inflow and an outflow. While skin does not have an inflow, does not have an outflow, it comes into the tissue category. But bones.
Then when it comes to the demand and supply, I think it's almost the same.
Yeah, in fact, the donation of skin is even less as compared to solid organs. So the gap there is enormous. Like there is hardly any supply as compared to I wouldn't even say we have 1% of the supply. The gap is more than 99%. But having said that, there are other alternatives. Like, if you don't have a human skin available, you could use synthetic grafts to dress these patients, and it doesn't really take away the life, although the chances of healing are better with the skin. But in case of solid organs, suppose you don't have a liver and you need a liver, you'll die without it. Right. Similarly, heart, lung, pancreas, kidneys. So these are directly life-saving, while in case of tissues, the direct impact in terms of saving lives is not as much.
Okay. And also a little bit about artificial heart transplant, doctor.
So there are several models of heart that have been built, from time to time. The first one I remember was like Jarvik 4, and then there have been several ones. But so far, it has not been replaced. The attempts have been because heart is a mere pump, more than any other function. The pump function of the heart is what takes care of life, and therefore it's easier to substitute a pump rather than a complex synthetic functioning organ. But in spite of that, we don't have a sustainable. You could keep somebody temporarily on a left ventricular assist device, but eventually that will have to be replaced by a human heart for a permanent solution.
Okay.
There is work going on in the area that you mentioned, but we haven't seen anything out in the clinics yet.
Dr. Tamil Nadu tops the chart of organ donation vis-a-vis North, where it is totally pathetic. So, what do you think? Can there be a state coordination?
So, organs have a shelf life, and the function deteriorates with time. And with distance, you need time, unless you have rockets to transport them. So until we come up with those, the time taken to transport these organs to far off distances jeopardizes the functional capacity of these organs, and therefore has the potential of putting the patient's life at risk. So even though there may be regional discrepancy in the rates of organ donation, and therefore the space at which patients do get a transplant, we are currently unable to offer the benefits of A region to B region. It would be best for the B region to focus on the reasons why the program is not developing there, and if there's something to be learned from the South, I would say that is the way forward.
Okay, but all these transportation difficulties, the challenges are there in Tamil Nadu as well, but still they will be doing good.
Yeah, Tamil Nadu has been divided into 3 zones for the same reason. So even if you have an organ in Chennai, you wouldn't want it to be transported to Coimbatore. Even that time taken is considered to be too much. So then there is no question of transporting an organ from Chennai to, say, Mumbai, right? It will be too far, that much longer, and that much more dangerous.
Okay, why aren't you able to take organs from Mumbai itself?
So the infrastructure, the healthcare infrastructure in Mumbai has to be geared towards optimizing the programs on organ donation. It starts from identification, and there are several nuances which have to be optimized in order to have a better yield of cadaveric organs in any system, in any geography. It's all about focusing on the program.
Okay, so could we say that, as far as infrastructure is concerned, Tamil Nadu also tops it?
Well, I would say that Tamil Nadu has among the best, but I wouldn't say that other regions don't have comparable infrastructure. If you talk about manpower, yes, I would say that Chennai enjoys the prestige of being among the top in infrastructure, manpower related infrastructure in healthcare, particularly transplantation. Probably comparable to Delhi, but the rest of the country would fall very far away from Chennai and Delhi.
Okay. Doctor, also there's an allegation that the organ registry or the priority list is not often transparent. What do you have to say about that?
So different organs have different waiting lists, and every organ has a organ specific mechanism of organ allocation. In kidney, it is chronology. In livers, it is related to the sickness of the recipient. So the sickest patient gets transplanted first. And therefore, every week, every institute has to send an updated waiting list to the Cadaver Transplant Program Authority, the Transplant of Tamil Nadu. And whenever during the subsequent week an organ becomes available, it has to be allocated as per the priority list sent to the government, updated every week. In case if there is an acute or an urgent reason related to the discrepancy in size or a mismatch between the donor and the recipient, the programs are allowed to make changes in accordance to the discrepancy. Subsequently, that reason for the change in priority or allocation has to be informed and justified to the Transplant authorities. Okay. Transplant has a right and an obligation to audit all the transplant programs every 3 months, and programs found to be delinquent or discrepant in the processing of the allocation criteria stand a risk to be debarred from the organ allocation and even risk losing the license.
Okay, Doctor, sorry to intervene. Do you think it really happens? What I'm trying to say is, if it is a VIP, I think there is a skip. This is something that people feel, but at the same time, if there's a common man as a patient, the rules are very stringent.
So, I'm very sad to say that it is very easy to point a finger at somebody, while we always forget that there are 3 pointing towards us. So, there is forever a paranoia that the world is deviated towards the rich and unfair to the poor. If you look at Tamil Nadu's organ allocation program, it is distinctly and very much in favor of the underprivileged patients who are getting treated in the government hospitals as compared to the private hospitals. The entire allocation system is biased in favor of them. One. Two, even a VIP can be as sick as a common man. And what happens to the VIP, it just is a part of news. That is how it becomes known to people. But we favor the sick and we favor the sick, irrespective of the socio-economic cadre. So we would help or support a sick poor just as much as we would support a sick rich. Okay. It is just that the rich hits the news, the poor does not hit the news.
Okay. And last question, doctor. This is about the former Chief Minister J Jayalalithaa. It has been rumored that she underwent kidney transplant in Apollo Hospital. Were you a part of the team?
I would not be aware of any such activity, and like I said, I am neither a part of the team that does kidney transplants, nor am I aware of what you are saying. I will not be able to comment on either an affirmative or a negative on that.
Okay. Thank you so much for talking to Kowai Post.